Hi everyone, Jackie from Active Health Clinic, and today I'm here to talk about all of these different terms because in the clinic and over many years of experience, I guess we've heard these terms used interchangeably, and what I've noticed is that it can cause a hell of a lot of confusion for patients because they're thinking, well, do I have dysautonomia? Do I have POTS? Do I have OI? Do I have vasovagal syncope? And like I've been talking about in a previous video about EDS, is we kind of think about, well, does it always really matter what we call something? Because at Active Health Clinic, we are going to treat your symptoms, not always because of what something is called. Diagnostic criteria is there for a reason, and it really helps in terms of, having a proper diagnosis for whether it's medical reports, NDIS, medical certificates, etc. But I just wanted to go through these terms and explain a little bit more simply about, well, what's the difference and what are the main features, okay? So dysautonomia it's actually an umbrella term, and then we've got all of these other conditions that sit underneath that. So dysautonomia is about the dysfunctioning of our autonomic nervous system. So the autonomic nervous system, like it indicates, it helps to regulate the automatic systems in our body. So this is our heart rate, our blood pressure, our respiration, our digestion, dilation and constriction of blood of our pupils, our kidney function, and our temperature control. And when I describe all of those systems that it actually helps regulate, you can probably be sitting there thinking, well, yes, I have a problem with my digestion and my blood pressure and my heart rate, etc. And this is why we call it, so we've got dysfunction of the autonomic nervous system. So it's a pretty great name overall. So people living with various forms of dysautonomia have trouble with regulating these systems, as I said, which can result in lightheadedness, fainting, unstable blood pressure, and abnormal heart rate. So whether that is a tachycardia or a bradycardia, ectopic heartbeats. So then we go on to, what are the different forms of dysautonomia in which POTS is actually one of those? So postural orthostatic tachycardia syndrome, so pretty self-explanatory. So when we change posture, what will happen is that we can get an elevated heart rate, because what happens is that when we go from being so either lying or seated to being upright, the blood can tend to pull into the pelvis and into the legs, which means the signals from the brain to the body say, well, we don't want to face plant the floor, so we need to speed up the heart rate to make sure that we get blood back to the brain. This can also result in shortness of breath, chest pains, exercise intolerance. And I'm very cautious about talking about exercise intolerance because obviously this is a main form of treatment for people with dysautonomia, POTS, and all of these conditions. However, we've got to be very careful about the word exercise. So what we want to be looking at doing is improving the body's ability to regulate heart rate and blood pressure and ensure that there is good circulation around the body. And exercise does not mean going to the gym, riding a bike, going swimming, etc. We tailor this to being movement for a bedbound person right through to somebody who has POTS, such as myself, who can walk, do some swimming, etc. So it is very much a tailored approach. And again, the temperature control, everybody knows that. They get hot and sweaty 1 minute, freezing cold, feet are purple, and really, really cold the next. So, very normal for these types of conditions. Then we want to move on to, neurocardiogenic syncope also known as vasovagal syncope. So same. And neurocardiogenic syncope is the most common form of dysautonomia. So pretty much you're fainting. So what this is people can either have 1 or 2 fainting spells in their life, or they may be fainting 1 or 2 times a day. So it can become pretty debilitating, and what can actually happen is that people will often have a little bit of probably POTS associated with this, and low blood pressure, all those symptoms I talked about before, okay? This is still a mechanism that is a bit poorly understood, and this is often a diagnosis that is seen more so when people are having tilt table tests. So that's where we see this one come up a lot more. And then dysautonomia can occur secondary to other illnesses such as diabetes, Parkinson's disease, multiple sclerosis, rheumatoid arthritis. We can see it in some of our chronic pain conditions, lupus and celiac disease. So this is why, dysautonomia is not just about this one and this one. There are other conditions as well. So diabetes, for example, we have, peripheral neuropathies. So that autonomic nervous system not working very well. Then I want to move on to, orthostatic intolerance. Very simply, you are intolerant to an upright posture. So again, this is another umbrella term for conditions that sit underneath it. Now, in terms of orthostatic intolerance, we can have it in the form of POTS, and then there is also orthostatic intolerance in the terms of autonomic failure, which is Parkinson's disease, for example. Okay, and then lastly, we have orthostatic hypotension. So exactly, again, what it says, orthostatic, so the inability to tolerate upright posture, hypotension, drop in blood pressure. So this is where, the blood vessels, particularly we might see this maybe a little bit more in the hypermobile type people, where their vessel elasticity is like their joints, it's a little bit floppy, and therefore when they stand up or they've been unwell and had a significant period of maybe deconditioning, and we haven't got the muscle pump to help move blood flow, is that the blood pulls very quickly into the pelvis and the legs, and therefore we can have that drop in blood pressure and fainting. So hopefully that has cleared up and made these big, long, scary words a little bit more straightforward. And again, as I said at the start, they are all kind of same, but a little bit different. But either way, we treat you as a whole person, based on your symptoms, not always what it is called. And yes, there will be an overlap, no doubt, an overlap with a lot of these. And depending on who you see, whether it is cardiologist, rheumatologist, neurologist, they will all have a different belief, a different understanding, and therefore the terms are used interchangeably. So again, let's just not get caught up too much in what things are called and wondering, do I have this, or do I have this, or do I have this, this, and this? We're just going to have a look at your symptoms and treat that overall person. So I hope that has helped clear things up a little bit. If you know of somebody that would really benefit from having a really good understanding, or just that differentiation between the types, make sure that you tag or share this with those people, and head on over to our YouTube, where I will be doing a few more videos around these types of conditions. Thanks everyone.